Irritable bowel syndrome, causes, symptoms, and relief. Irritable bowel syndrome affects about 54 million people in the United States, or about 20% of the population. It is an intestinal disorder with no indications of disease, but which for unknown reasons causes discomfort, diarrhea, constipation, cramping, gas and mild to severe pain in the abdomen. The pain of IBS can vary from a throbbing internal bruising feeling to sharp cramping sensations. Patients often complain that it feels like they got punched in the stomach or stepped on by an elephant. IBS is a general term to describe general irregular bowel functions that do not show up during examinations, blood tests or X-rays according to the FDA. The National Institute of Health say that people who live with IBS simply have more sensitive digestive tracts. Their colons are more likely to react to stimulus than other adults or children with normal colons. IBS attacks can be triggered by eating greasy or fatty foods, some kinds of dairy products, certain medications, depression, gas, stress, lack of exercise, and even by eating raisins or corn. An FDA report quotes many IBS research subjects as saying that the disorder has affected their everyday life. One teacher in Connecticut told them that she had to give up teaching in a classroom because her condition prevented her from being able to stay with the kids all day. She even purchased a van to give her more privacy in her time of need and keeps a fresh pair of underwear, anti-diarrheal tablets and other emergency items in there just in case. Constipation is also an effect of IBS. Some adults and children have reported not having a bowel movement for up to 10 days at times. When they finally go to the bathroom, it is extremely painful and rectal bleeding often occurs. In both cases of diarrhea and constipation episodes, severe pain usually occurs. Human's digestive system has a nervous system that is separate from the brain and does not depend on the brain in order to function properly. Instead, according to Marcelo A. Barrero, MD of the FDA's gastrointestinal division, the intestines respond to its inputs under various conditions. He also says that in patients with IBS, the central nervous system and the gastrointestinal nervous system are out of sync. This means that if an individual is under particularly heavy stress, then the brain may send a conflicting message to the intestines that invokes irritability within the digestive system. Treatments. Unfortunately, because IBS affects everyone in different ways, there is no cure or treatment. Antispasmodic medications are sometimes used to treat IBS, especially when other treatments don't work. IBS sufferers can try to manage their disorder with a high-fiber diet, lots of water and regular exercise. Also, individuals with IBS should avoid certain foods like dairy, cabbage, beans, sorbitol, artificial sweeteners and fructose. Probiotic supplements are an effective way to reduce gas and harmful bacteria. Although, most healthcare practitioners don't recommend even bothering with probiotic treatments unless you have done a colon cleanse first. While probiotics can promote good bacteria in the intestines, it doesn't do anything for the buildup of plaque and waste along your intestinal walls. IBS is a difficult disorder to live with, especially since an effective treatment can be difficult to find among individuals. However, with good diet, exercise, plenty of water, and regular colon cleansing, it can be managed.